Good evening, everyone. I am thrilled to have Dr. Shivam Dubey with us, a renowned psychiatrist and the founder of Mental Health Education, a nonprofit organization based in Florida. Dr. Dubey, thank you for joining us.
Thank you for having me. It's a pleasure to be here.
Of course. Could you tell us about your education and your practice?
So I'm a psychiatrist. I'm board certified. I have worked in multiple states in America. I started from Massachusetts, where I did my training at Harvard Medical School affiliated program. It's called Harvard South Shore Psychiatry Residency Program. Later, I practiced as a psychiatrist in Indiana, California, Florida, North Carolina. And now, after so many years, I'm currently working as CEO of Mental Health Education. It's a nonprofit based in Florida. I'm also the founder of the MindSync, which is a company which develops educational program, mental health educational program for children and adults.
Could you tell us more about mental health education?
Yes. So mental health education, I started this nonprofit mental health education because I felt there is a need for education in mental health. So, I was practicing as a psychiatrist for so many years, and then I was seeing that patients are keep coming, the mental health epidemic is there, stress is increasing. So, I was not sure what I'm doing, like I'm practicing seeing kids and adults and treating them. But I felt like this mental health epidemic we are not able to control it, Uh, so it actually happened. I was working in a small city in Midwest in Indiana, and a 10-year-old girl came to me with her mother, and she was crying, and she had deep cuts on her arms and her thighs. And I was like, wow, what is that? I was really stressed, and so I thought I need to admit her to the inpatient, the hospital, because she was like cutting and self-harm. And then the girl knew that I was going to do that, and she asked me and said, "Doctor, I don't need to go to hospital." I said, "Why? I'm really worried about you." And she said, "You know what, doctor? I have a lot of emotional pain and I cannot take it. So that is why I have this physical pain, the cutting and all that. That helps me transfer my emotional pain to my physical pain, which I can take it." And I was like, "Really?" Because I'm scared of even a needle stick. So I
Same.
was like, "Really? She can take these cuts?" And then what I'm seeing all around is that people have these emotional pain these days, and they cannot control it. They're not able to manage their emotions, and they are using drugs, alcohol, and so many other ways of controlling their emotional pain.
It
So
just shows you how deep it goes.
yeah, and I was like, what can we do to help these people learn skills so that they can at least manage it, so that they don't have to do things like that,
Mhm.
like cutting or alcohol or drugs. So then, and then I see that I think that is might be lacking. That is why we are having such an increase in mental health globally, mental health problems globally. And that I felt that, that maybe that is what is lacking in our system. And it is. If you
Mhm.
have to control a disease in a community, you have to use primary, secondary, tertiary prevention. Like if you have to control a heart disease in a community, you will use primary prevention, in which you will teach people, to be, healthy by eating healthy, exercise every day, a lot of education you will do, not smoke cigarettes,
Mhm.
control your cholesterol and everything to prevent heart problems. That is primary prevention. Then secondary prevention is when you go to your doctor to get checked, and you control if you have developed any heart disease like hypertension or something, right? In mental health, what we are doing is we are treating patients, we are teaching people to find out if they have depression or anxiety, what are the symptoms of it. But we are not teaching them how to prevent it so
Mhm.
that they don't even develop it. Prevention comes before the disease.
Right.
Right? So is there any program in our society which could help people learn skills so that they know how to deal with stress and could prevent onset of illnesses like mental health problems, or could actually help them deal with it if they have got it.
I'm not aware of anything like that, and I think it's incredibly important.
Yes. And so that's what I started looking at, like around 5, 6 years ago. I had the same question. What is it? Is there anything that could be used as primary prevention?
Mhm.
You know? So then I looked into some research and I find out, yes, there is. There is an evidence that social emotional learning, if taught to children, and there's a 2 decades of research which is showing that if you teach the social emotional learning to the children, there's so many benefits with mental health and so many other things.
So could you please elaborate on that concept for our audience and share some evidence to support it?
Yeah, so like I said, mental health education, if you talk about mental health, just mental health, what is mental health? According to World Health Organization, Center for Disease Control and Prevention, CDC, the mental health is described as a state of well-being wherein individuals can effectively manage the challenges of life, recognize their own potential, cope with everyday stress, work productively, build and maintain relationships, and contribute meaningfully to their communities. That is what mental health is defined as. So, what could be mental health education? Something that teaches you to achieve all that I just said,
Mhm.
right? So, what is it that could be used? So, I just told you about what is mental health education could be. It should be something that teaches people how to stay mentally healthy. And social emotional learning, after 2 decades of research, have shown that it could benefit with mental health problems, and it could help people stay mentally healthy.
That's absolutely fascinating, but I think a lot of our audience is probably wondering right now what social emotional learning actually is. So could you please elaborate on the definition of it and expand upon that?
So, to make it very simple, social emotional learning is about 5 competencies. After all this research, they figured out that if you teach 5 competencies to children, it could help children in so many ways. So, what are those 5 competencies? And you know what, guys, whatever I'm going to tell you right now, it makes so much sense. So, guys, the social emotional learning is about 5 competencies that we teach to children, and even to adults, we can teach those 5 competencies. And these 5 competencies are so simple to understand. And if I tell you right now, I'm sure you will be agree with me that this is nothing, something like comes out of a big research. We all know that it could help. So let's look at the 5 competencies, okay? Self-awareness. So teaching a child about self-awareness involves understanding his own emotions, his personal values, his goals. When you're aware of your strengths and limitations, then you can work on it, right? Self-management, that is the second competency, is about ability to manage your emotions and behaviors, right? Manage stress, control impulsivity, right? Then third competency is relationship skills. Help student establish and maintain healthy and rewarding relationships. The skills involve like communicating clearly, listening actively, cooperating, resisting inappropriate social pressure, negotiating conflict constructively, and seeking help when needed. Another competency is responsible decision making, which involves learning how to make constructive choices about personal behavior and social interactions. It requires the ability to consider ethical standards, safety concerns, accurate behavioral norms for risky behavior. How does a child learn how to take a responsible decision? This is something is taught in social emotional learning. And the last competency is social awareness, which involves the ability to understand, empathize, and feel compassion for those with different backgrounds or culture. We are becoming a global community. We are coming closer and closer. The world is shrinking, right? So we need to help our children. Yeah, so these are the 5 competencies that if you teach to a child, then child could learn skills that will help him in day-to-day stress. Let me give you an example. When you learn to drive, like when you were like 14, 15-year-old, you were trying to learn driving, you will pay attention to the first time you're in the car, right? You pay attention to the steering wheel, the brakes, right? You'll be a little nervous, right?
Mm-hmm.
And now, after 1 year of practicing how to drive the car, now you drive the car and you're on your phone and you don't even know when you press the brake, right? You don't even know how many red lights you crossed, right?
Mm-hmm.
So who is driving the car? You learned how to drive the car and you somehow created some kind of a neural circuit in your brain, which is running your car now. Similarly, how about if we teach a child or an adult how to be patient, how to be calm?
I could use that.
Or we can teach them how to cooperate, how to be kind, right? Do you think these skills could be trained?
I think so.
Skills that could be taught to child, and they could actually make healthy neurocircuits that when they need patience and calmness, they don't have to think about it. They will automatically happen like you press the brake.
What age can you start doing this with children?
Well, the child's brain is very neuroplastic. It's learning from day one. But social emotional learning, ideally, we should start from kindergarten.
Okay.
I think that will be a good age to start.
Well, speaking of neuroplasticity, could you explain what that term means and how it relates to mental health education?
Yes, the neuroplasticity is the idea that the brain is the organ that's built to change in response to experience. Whatever experience you are having, your brain changes accordingly and learns. The environmental factors influence and shape the brain. The emotional environment in early life, in particular, is very important in shaping your brain. And the things that you learn in your childhood could, stay with you for all your life. Just imagine like a child could be learning that he's socially awkward. He may be learning he's not loved.
Mm-hmm.
Depending on where he's living, in what circumstances, what, family and what society. He could learn not to trust people. He could learn to be negative. And all this could become his core beliefs while he's growing up. And that could affect all his life, his relationships, his interactions, his productivity.
Okay, so that's a lot of pressure. Of what can we as parents do to help kids develop a healthy brain?
Because I think the skills that you need to learn comes from home and from the family.
Mm-hmm.
So I think the parents should look into mental health education programs based on evidence-based strategies like social emotional learning. And if they should be able to use those programs at home, that will be a game changer. That could help kids learn better core beliefs. That could help them learn self-awareness, self-management, how to make right decisions, how to manage their relationships, how to be social aware. So what the mental health education, our nonprofit has come up with this thing called Give the Gift of Mental Health Education of Social Emotional Learning to Child. We want to start this campaign through our nonprofit that we want parents to, if they want to give their child, give them a gift of social emotional learning and mental health education. I know you love your children, and you are giving them all kinds of gifts, toy gifts, shooting guns, cars, Barbie dolls. But I think the time has come that you give them a gift of mental health education, social emotional learning program. And our mental health education nonprofit is promoting those kind of programs. And one such program is called the MindSync Kids program.
Now, what about the mental health epidemic?
Yes. So I think that treating mental health problems, diagnosing them, treating is not going to be enough. to control this epidemic. We need to start seriously look into primary prevention strategies for mental health. I think that is the way to go. And we need to have a global alliance, not just locally. I mean, we can start locally, but we need to work together. And that is why the mental health education, our nonprofit, is working globally. We have operations in India, we have operations in America, and we are gradually going into different countries. We have mental health education teachers all over the world, which are providing education to children. Most of our educators have masters in psychology, and they are rigorously trained in social emotional learning.
How can we provide mental health education to our kids?
I think to provide mental health education to your kids, I think parents need to research social emotional learning or mental health education programs and enroll them. And like I said, school and government, they are trying to teach social emotional learning, but I think it should start from home. You should start getting the programs which could be provided at home. I'll tell you, one such program is the Mindsync Kids program that mental health education, our nonprofit, provides for free.
Well, let's focus on mental health education, your nonprofit. How does your organization provide mental health education, and why is it offered for free?
Mental health education, our nonprofit, focuses on mental health education programs which could provide education based on evidence-based strategies like social emotional learning, helping the child learn self-awareness, self-management, decision-making, relationship skills, social awareness. And we are currently using the Mindsync Kids program and providing it to children for free. And we are currently using Mindsync Kids program, which is developed by our team of psychologists and psychiatrists, and it's based on social emotional learning and neuroscience. And it's provided by mental health education teachers. And we have our teachers all over the world. Mental health epidemic is global, and our mission revolves around addressing mental health crisis on a global scale by facilitating connections between educators and students worldwide. We provide one-to-one teaching of mental health based on our curriculum by our mental health education teachers online. And we provide it for free because we believe mental health education is a human right. If a child or adult does not have the skills to survive in this community because of the stress, then that is something needs to be taken care of. And that is why I believe that mental health education is a human right and it has to be provided to everyone.
How is it different from social emotional learning programs provided in schools?
Yes. So our government and governments all over the world are focusing on providing social and emotional learning programs in schools. So in schools, the social emotional learning programs are provided by teachers. So like, or the school counselors, and they are provided in groups. But the program that we have developed, the Mindsync Kids program, we provide this program by masters in psychology graduates who have also been trained in social emotional learning program. And it provides our curriculum, which we have developed based on neuroscience. And it is provided one-to-one. And we provide it at home so that the whole family gets to learn about it. And then we also developed a mobile app which the child and the family practices after the session they have just taken with their instructor. They practice the activities they learn on the app. You remember the concept of neuroplasticity, right? How do you learn how to drive a car? By practice. So if a teacher, our teacher is teaching you how to be patient, how to be cooperative, kind, compassionate, have good focus, take good decisions, you have to practice it. I'm not sure about in schools if there are effective ways of helping kids practice those competencies at home. That is why we developed this mobile app, which is at home, they practice on the mobile app those skills. You know that kids are using all kinds of apps these days. Every child is on YouTube, TikTok, and all those kind of things. I don't know what they're learning out there. But our program and our app is just 15, 20 minutes, 3 to 4 times in a week. That is it.
Okay. Not bad.
Yeah, not bad. And even
Not bad, and a big impact.
yes, and there is something in the for the family also in that app, so that not only a child learns those skills, but the parents could also learn, because it will help them also in their lives. There is a lot of research going on adult SEL too, adult social emotional learning.
All right, so we've spent a lot of time covering what the program is. So for anyone who's watching and wants to get involved, any parents or children, how can they do so?
Yeah, it's very simple. You just go to our website, www.themindsynckids.com. I think you can have the link in
Yeah,
below.
we'll add it below.
Yes, you can just go there, look at the website. Everything that I talked today is there. And you just click on book your session. And that will take you a series of steps, and you will be able to schedule appointment with our mental health education teachers.
Easy.
Yes, easy peasy. And you just attend sessions with our teachers on Zoom. Approximately one session is like 30 to 45 minutes, depending on what we are talking about. And then after that, you can practice app and have another session. So we teach all 5 competencies through our program, and you can pick which competency you want, or you can complete all the competencies. It's all free. You can also follow us on Facebook and Instagram. We have a lot of information out there about our programs, and you can use that link to register your child for our programs.
Dr. Dubey, do you have any advice for other mental health professionals?
Yes, to all my mental health professional colleagues, this is the time that we need to start looking into mental health education seriously, to help our children and adults learn these basic coping skills. And I would welcome you to Mental Health Education, our nonprofit. And please connect with me, or send me email or text me, and we can collaborate. We would love to collaborate with mental health professionals and primary care doctors and pediatricians, and everybody in the healthcare business, so that we can provide mental health education while you are treating your patients and doing the good job that you're doing. One thing I would like to say here, very important, is that we do not provide any diagnosis, treatment, therapy. We only provide education. We do not take any insurance. We do not take cash. We do not take any sort of payment, because we do not treat or provide any kind of medical treatment. We only help you learn skills through education program.
A lot of what you mentioned today, such as patience and being calm, I think I could learn a lot from. And I have a 1.5-year-old toddler right now. And so we will be enrolling in this program in a few years, and I will definitely make sure I take it with him. But it's been a pleasure speaking with you. This was so informative. I think that you're going to help a lot of people all over the world. So thank you for enlightening us about the importance of mental health education. Your work is making a huge difference in the lives of many, and we really appreciate your time today.
Thank you very much. It's my pleasure talking about it.